Let's get going. This short video will give you some guidance and some exercises to get you back on your feet after your surgery. Don't forget, if things are sore, stop. First of all, we'll start with simple stretching exercises. The quad stretch. Stand and hold the back of a chair for some support. Bend one knee, raising your heel towards your buttock. Pull your heel higher. That's it. Feel it tight at the front. Hold it there for 30 seconds and then slowly start to release it, and repeat on the other side. Try and do this 2 to 3 times, or as frequently as you can. Let's move on to the lying hamstring stretch. This is stretching the hamstring muscle at the back of your thigh. Try and lie flat on your back, lift one leg straight up and feel it tight at the back of your leg. Pull your leg towards your head as long as you're not uncomfortable. Try and hold it for 30 to 60 seconds. Try and repeat this on the other side. If you can do this 2 to 3 times, that would be great. A calf stretch. Stretching the calf muscle and the Achilles tendon at the back of your heel. Stand in front of a wall. Place your hands on the wall and take a step back. The leg behind should be kept straight and you should feel it tight in the back of your calf. Keep both heels flat on the floor. Bend the front knee, keeping the leg straight at the back, and feel it stretch. It shouldn't be sore, but it should feel tight. Try and hold that for 30 seconds. Try and do this 4 times, but try and do it as many times as you feel comfortable, and repeat it on the other side. Let's move on to some strengthening exercises. Do your stretching routine first, and try and do this up to 4 to 5 times a week. A half squat. This is really working on the quads muscle, the hamstring, and your glutes. Stand straight with your feet at shoulder width apart. Extend your arms out in front of you and slowly lower your hips by 10 inches or so. But just go as low as you feel comfortable. Keep your weight on your heels with your feet flat. Try and hold it for 5 seconds or as long as it's comfortable. Try and do this up to 10 times if you can, but as many as you can do is fine. The next one is a calf raise. This is standing on your tiptoes. It helps strengthen the calf muscle. Stand straight using the back of a chair or the wall as a support so you don't fall. Lift one foot off the floor so that your weight is supported on the other, and raise your heel as if you're standing on your tiptoes. You should feel all the work in your calf. Repeat the other side and try and do this 10 times, but again as many times as you can. A hamstring curl. This is bending your knee as far as you think you can cope. It strengthens the hamstrings at the back of your thigh. Stand straight using the back of a chair or a wall as a support again. Bend one knee, raising your heel back and upwards. Hold it for 5 seconds. You should feel some tightness in your hamstring but not pain. Try and do this 10 times, but again as many times as you feel comfortable, and repeat on the other side. A leg extension. This is straightening your leg. This is predominantly helping to strengthen the quads muscle at the front of your knee. Sit on a chair with your back straight. Slowly raise one foot forward so your leg becomes fully extended. Try and hold that position for 5 seconds, or as long as you feel comfortable doing so. Try and do this 10 times, but again, do it as many times as you feel comfortable and try and repeat it on the other side. So a lying flat leg raise. This again strengthens the quads muscle at the front and also your core. Lie on your back and prop yourself up on your elbows. Try and do this on a comfortable carpeted floor so it's not uncomfortable. Bend one knee, lift straight with the other leg about 6 to 10 inches off the ground. Try and hold that for as long as you can, and then relax and lower it back down. Try and do this 10 times and repeat it on the other side, but as many times as you can is fine. Prone leg raises or lying flat on your tummy. Again, try and get comfortable. This is to work on your hamstrings and your gluteal muscles. With your legs straight out behind you, try and raise one leg up off the ground. You'll feel it tight in your back of your thigh and try and hold it for 5 seconds. Repeat on the other side and try and do this up to 10 times, but really, again, as many times as you feel comfortable. Hip abduction, or bringing your leg away from your body. This works on your abductor muscles. These are muscles around your pelvis. Lie on your side and support yourself with your arm. Keep the lower leg bent. Raise your other leg away from your body up to 45 degrees and hold it for 5 seconds. The number of degrees and the time you hold it doesn't matter. Just try and do as many as you can. If you can do it 20 times, that would be amazing. Try and repeat it on the other side. Hip adduction. The adductor muscles, or the muscles on the inner side of your thigh, are the ones that bring your legs towards your body. Cross your upper leg in front while lying on your side. And it's the lower leg we're lifting now. And raise it up off the ground and try and hold it for 5 seconds. This is quite a tough one. If you're not comfortable on the floor, this is one you can skip. But if you can, hold it for 5 seconds and do it as many times as you can. Then turn over and repeat it on the other side. If you have a TheraBand or an elastic band, this is a good one to strengthen the hamstrings and your quads. Lying flat on your back with your elbows bent, using the rubber band under your foot. Once it's there, straighten your leg out and try and hold it for 2 seconds and bring it back. Try and do 10 repetitions and repeat it on the other side if you can. So in summary, these are all the exercises we've just gone through. Again, don't get too focused on the number of times or the repetitions, just try your best and do as many as you possibly can. Strengthening your joints helps stabilise the knee and relieves pain and prevents further surgery. Stretching keeps your muscles long and flexible and reduces the soreness and improves joint mobility. It will help you before your surgery and afterwards. The physio after your surgery will go through which ones are good for you and which ones you should avoid, but this is a really quick guide.